Hey everyone, my name is Dr. Jocelyn Conley. I'm a pelvic floor physical therapist and founder of the Vagina Doc. And in this video, I'm gonna go over the standing hip turnout that will help you with hip control and overall leg and pelvic floor health and performance with turning while walking. Why is this important? Well, a lot of people that have issues with their pelvic floor and they're having leakage or pain problems, recurrent, repetitive stress injuries anywhere in their leg or leakage, there's often a relationship from lack of hip stability while performing everyday functional movements. And turning is a big one, as well as walking. In therapy, we give our patients hip stability exercises like you're laying on your side and you're rotating your hip with your ankles together, called the clamshell, lifting your hip out to the side, working on balance, working on core function. But if those exercises are not related to how to, if you're not taught how to apply these exercises to function, then it's not guaranteed that they're going to carry over. This is a more complex exercise and movement in that we can literally focus on so many different things at once. We can focus on the foot component. We can focus on the hip component. We can focus on the upper body component. So when you do give this a shot, do not try to tackle everything. Just focus on one thing at a time, and do realize it does take time to put it all together. So let's get into it. When I go to turn, like let's say I'm walking and I do this, I want you to pay attention to what happens to my knee. And I'm gonna turn the camera just down a little bit so you can get a better view of my knee. So look what happens here if I'm starting to walk and then I turn. Kind of caves. This is called knee valgus. And at the same time, my foot caves in as well. So remember what that looked like. And now what's the difference between this? So if I go and turn like that, do you notice how there's not this ugly bend in my knee? Like I'm not doing that. I'm actually opening up my hip. What I am doing is I'm actively engaging my hip stabilizers and really open it as I turn my upper body or my torso to go to the other direction. And then it's an exchange of weight, so I'm shifting my weight onto my left leg and transitioning from there. So go ahead and give that a shot, and then when you identify what you do, if it's this, or if you can in fact do this, which what I'm doing is I'm making kind of like an L. I'm taking a step, making an L. My whole torso moves, and then I'm keeping my hip open like that. Then it's time to move on to the next part of this drill and activity. So this next part is I want you to squeeze your glutes and actively push off this foot, and then just tap onto the other side and then come back. So you're gonna push, squeeze off this leg, and then tap here, and then push off, come back. It's kind of like a dance step. And once you are weight shifting onto this leg, you can unweight this leg just a bit, but just don't let this happen. And then you're gonna push off, pointing your foot, using your calves to come back. Next step from there is then actually, you could do two things. You can actually walk, or you can do it like this. But just know you have more things to focus on as you do this, because now I have to push off, then I have to accept my weight and then come back. And there's so many ways you can enhance just accepting your weight. You can squeeze your glutes, you can control with your calf, You can take it from heel to the front of your foot. Depending on what you present with is how I instruct, rather than saying one size fits all. What you can do to learn how to use that, keep your hip active without, having to necessarily think about squeezing your butt, is you can place an elastic band around your knees, at the level of your knees, because if you don't keep your hip active, then what happens is the band really yanks on your knee. So the band is almost kind of makes it easier but harder in a sense, because it gives you that reminder to use your hip muscles. Once you really lock in the hip part, then you can start focusing on your other pieces, like your deep core of your foot. Some of the things with breathing, but really just focus on one thing at a time. A drill that I like to, I showed you the drill I like to give my patients. It's this, and then it's this, and then it's walking. And then this progresses into more of an athletic movement like running for my ACL and knee and hip injury, and pretty much everything. And I just apply the same concepts but specific to their issue, and it could be anything. I hope this was a helpful video. If you have any questions, please comment below. If you thought this was helpful, press the like button. If you know anyone that can benefit from the video, share it with them, and then don't forget to subscribe so that you're notified every time a new video drops. Thank you so much for watching. And again, my name is Dr. Jocelyn Conley. I will see you next time.